speaker, Dr. Ruju, UNADKAT.
Forge your weapons in the fire of need. How? Let's figure out with this presentation on dose-escalated intravitreal topotecan in retinoblastoma. Vitreous seeds have been identified as the most common cause of treatment failure post-chemotherapy. Intravitreal injection of chemotherapeutic agent solved this problem to quite an extent. It started with melphalan given in dose of 8 microgram, but high rate of recurrence was noted. So a shift to 50 microgram was done, but soon discontinued because of its propensity to cause retinal toxicity. So now new balance was found between 20 to 30 microns. Melphalan was then challenged by Topotecan because of its effectivity, safety, and stability for longer duration. But refractory vitreous seeds were still a challenge, so a practice of combined topo plus melphalan was initiated. Also, effectivity of intravitreal topo at the dose of 30 microgram was emphasized. However, suggestion of high dose 90 microgram opened an entire new window of hope, specifically for its use with subretinal seeds and recurrent retinal tumors. So our study was designed with a purpose of evaluating role of dose-escalated intravitreal topotecan in terms of its efficacy, safety, complications, and outcome. It was a retrospective, consecutive, non-comparative observational case series which included 31 eyes of 31 cases over a period of 35 months. However, cases receiving any form of concurrent IVC or IAC were excluded. All the cases with focal seeds only in one quadrant were given IVT in dose of 30 microgram. Seeds in two quadrants received 45 microgram, seeds in three quadrants received 60 microgram, and highest dose of 90 micron was given to those with diffuse vitreous seeds or seeds in all four quadrants. For focal subretinal seeds, dose of 60 micron was given and escalation to 90 was done for diffuse subretinal seeds. Cases with less than 3 mm size small retinal tumors were given IVT in dose of 90 micron. Following are the derived results of demographic details. Majority of cases belong to baseline group D and E. Most common indication being diffuse vitreous seeds. Out of total 27 cases with vitreous seeds, primary dose escalation was done in 44% and 56% required secondary dose escalation. Interestingly, we found that with the secondary dose escalation, average number of injections required reduced to half. This case with diffuse seeds received 90 microgram IVT and laser TTT for the residual tumor and showed complete regression. This case with dense cloud of vitreous seed completely regressed and cleared after 5 injections. Case with juxtapapillary seeds regressed and became amorphous. In this very interesting case of diffuse vitreous seeds, patient initially responded well to 30 microgram but soon became refractory but regressed completely after dose escalation to 90. Of total 9 cases with subretinal seeds, all responded well with an average of just 1 IVT. Yes, you heard that right, with just 1 IVT. In this case, with small retinal tumor recurrence, which was refractory to TTT, regressed completely with just 1 IVT. Trial of IVT was also given to cases with endophytic budding type of recurrences, cases with multifocal recurrences, case with juxtapapillary tumor recurrence, or optic nerve head tumor where TTT is unfavorable and showed satisfactory outcomes with complete regression in all. This is the regression pattern observed, and 62% regressed with a flat scar with an average of 1 injection. In a mean follow-up of 6 months, we noticed cataract in 2 cases and injection site cystoid cicatrix in 9 cases. Till the end of our study, 21 cases remained regressed, but 10 cases showed recurrence with an evidence of main tumor recurrence in 6 cases. Rate of recurrence derived for vitreous seed was hence the highest, 33%, and lowest for subretinal seeds, 0%. On reviewing the literature, there were only 2 similar published studies, but ours was the largest in terms of sample size. For retinal tumor, Initial tumor control was 100% in all the series and rate of recurrence was identical and highest for the vitreous seed. So to conclude, I would like to say, despite best of our efforts, eyes which were initially unsalvageable because of resistant or refractory seeds or recurrent tumors are now amenable to eye salvage by adopting a tailored approach, that is dose escalation between 45 to 90 micron as an effective and safe modality. And lastly, I would like to thank by saying refined arms are truly savior's art.
Thank you. So, quick question: the ones who actually recurred after systemic therapy and IVT, were they then eventually enucleated or plaque
so
or radiation?
out of total 10 cases, 4 required enucleation and all 4 of them had made massive vitreous seed recurrence. So that is also one factor which we derived, that for enucleation eye which could not be eventually salvaged, vitreous seed recurrence was the major factor for that.
Thanks.
Thank you.